Afternoon, everyone. This past Friday, Fran and I traveled to southern Ohio along the Ohio River, in eastern part of the state and southern part of the state, southeast Ohio. And we met with hospital officials, we met with health department officials, but we also met with nurses, with doctors, and just average people. And I think the thing that struck all of us was the stories about relatively young people in the hospital, 20-year-olds, 30-year-olds, 40-year-olds. Stories about a young mother dying and leaving, 3, 4, 5 children. These were just tough stories to listen to. And when we got back, I asked our team to kind of look at the data, the best data that we have in regard to that. And what's clear, and we've known this for some time, but that trip to me brought it really home, and also the data brings it home, is that our hospitals have more younger people in them today. It's because of the fact that our vaccination rate, and we'll get to this in a minute, but our vaccination rate among younger people is just a lot lower than it is with higher people. And we're dealing with the Delta variant today. And the Delta variant is seeking out anyone who is not vaccinated. So let me give you some of the numbers. And of course, last week we also heard directly from our children's hospitals about how these hospitals were filling up with young people with COVID, but also young people who had other problems, respiratory problems that normally would be occurring in the winter. So let's start with hospitalizations. Today's, let me go to hospitalizations. Today's numbers show we have 459 newly reported hospitalizations of people of all ages in the last 24 hours. That's our highest number since January. That was January 12th. In 21, we had 486 reported hospitalizations. So that's everybody. But even more startling is that more and more younger Ohioans are being admitted to our hospitals for COVID. It certainly is a significant change. You'll see the slide on the screen now, hospitalizations age 49 and younger. These are actually in raw numbers, so you can go back to July 4th. That number was 47. The last number, as you can see here, September 5th, is 398, and you just see how it's been going up. In January 2021, 16% of hospitalizations were among those under 50. Going to July 2021, that percentage had doubled to 32% of hospitalizations coming from those under 50. Despite the fact that our total hospitalizations now are lower than at the peak of last year's winter surge, the numbers of younger admissions have dramatically climbed. For example, during the week of September 5th, we had 398 hospital admissions for those under 50. And that was our highest week during the pandemic, our highest week for that age group. The bottom line is that we're seeing our higher numbers, our highest numbers ever of hospitalizations among those under the age of 50. Throughout this pandemic, even at the worst of times, we were not seeing this many younger people under 50 going into our hospitals. The clear difference between these younger Ohioans and the older Ohioans is the rate of vaccination, and we'll talk about that in a moment. Now let's look at those 39 years of age and older. Let's break that group out. And again, you can see how that number since the number on your left, which is 32, that was July 4th, and you can see it goes September 5th. That week is 230. Now let's look at these raw numbers. In the first week of July, 32 people that were 39 and younger were admitted to the hospital. Now the most recent completed reporting week, which is September 5th through September 11th, shows 230 Ohioans 39 years of age and younger were admitted to the hospital that particular week. This is the highest number of admissions for COVID in this age group during the entire pandemic, even higher than during the winter surge levels when no one, let me point that out, when no one was vaccinated. About 97% of patients of all ages in our hospitals who are there for COVID are unvaccinated. So it's no surprise that there are increasing hospitalizations among those age groups that have a lower rate of vaccination. It's that simple. Those that are 39 years of age and younger are 35% vaccinated, while more vulnerable Ohioans, those 40 and older, are 73% vaccinated. And just looking at the different, at the chart itself, you can really see, Eric, if you can put that back up, you can really see a huge, huge difference in vaccinations. And we've been watching this. There's nothing new, but it just shows a big, I'm sorry, Eric, I want the other one back up. I want the one of the age groups. If you look, for example, of everybody over 65, every age group is above 80%. 65 to 69 is 83, and that goes to 87 for those 70 to 74, 83% for those 75 to 79. Over 80, it's 80%. And you can see then if you get a younger group, it drops down. But when you drop down to those 20 to 29, we're less than half. We're at 47%. 30 to 39 is 54%. So a huge, huge difference, which, it accounts for what we're seeing out there and what is going on. Let me turn to the deaths. In January, 22% of those who died of COVID were 69 years of age or younger. Since death data lags, we'll take a look at July to compare. In July, 48% of COVID-19 deaths were among those 69 years of age and younger. Looking at the raw numbers, preliminary data shows 59 Ohioans younger than 50 died of COVID in August of this year. In other words, in August, on average, 2 people younger than 50 died of COVID in Ohio every single day. Last month, preliminary numbers showed 18 Ohioans 39 years and younger died from COVID-19. That's a sharp increase from what the number was in June, and that was 5 in June and 2 in July. We know what the problem is. The problem is the Delta variant is dangerous. It's driving our surge. And the solution is not very complicated. The data is very clear. Our solution is to have more people vaccinated. Let me now turn to Dr. Vanderhoff for any comments on that, and then we have some guests. Dr. Vanderhoff.
Thank you, Governor. Well, the numbers you've outlined today should really grab our attention because they tell us that if you're young and unvaccinated, it's now probably only a question of when, not if, you get COVID-19. And when you get it, without the protection of a vaccine, there is a very real risk you'll end up in the hospital or even in the obituary pages. The numbers really tell it all. COVID has changed and is now making younger Ohioans who aren't vaccinated very sick. Don't become a statistic when there is a simple, safe, and effective alternative. Go out today and get vaccinated. You'll be glad you did, your family will be glad, and your doctors and nurses will be grateful.
Doctor, thank you very much. Let me turn for just a moment to our schools. We will get new complete data on Thursday, so we do not have that yet, although we're seeing still some movements in our schools. We believe we are at about 59% of our students in public schools in the state of Ohio today who are in a situation where they're required to wear masks. So, as I said, we'll get more accurate data, up-to-date data, at least on Thursday, and we will report that number to you. So, as I said last Friday, Fran and I traveled along the river, talked to health experts, and nurses, and doctors who are really at the front line. And today we want to broaden that and look at different parts of the state and ask some people who are really at the front line, who are seeing things every single day, exactly what they're seeing. So we're going to start off to go to Cincinnati, and let me introduce Suzanne Bennett, medical doctor. She's the ECMO program director at UC Health. She's also an associate professor of anesthesiology and critical care at the University of Cincinnati's College of Medicine. Doctor, thank you very much for joining us. My understanding is you have a long experience in the ICU during this pandemic, and I wonder if you could just tell us, what the situation there is now, what you're seeing, maybe if there's been any changes over this period of time. And again, we thank you for being with us, and we thank you for what you do every day.
Thank you, Governor. Yes, I have been working in the ICU. I started as an ICU nurse and then transitioned to med school and an ICU physician with over 10 years of experience being an ICU doctor. And I've continued to work in the ICU throughout this entire pandemic, primarily in the cardiovascular ICU at University of Cincinnati Medical Center, where the sickest of the sick COVID patients received their care. Throughout the pandemic, we've continued to see critically ill patients with COVID, but recently those numbers have taken a steep incline. And at the same time, we're facing a significant national nursing shortage. These rising number of sick COVID patients places a significant burden on our beds, our medical teams, and worse yet, it creates scenarios that no one wants to think about, where we do not have the space for patients who would otherwise benefit from receiving their care at these large academic medical centers. A critically ill patient with COVID will routinely be on a ventilator, and that's no different now. They're sicker this time. They often require medications to keep them comfortable and be able to get air into their lungs, keep them pain-free. Their breathing may be so bad that the ventilator and the medicines aren't working. And then we have to turn them on their bellies instead of their back. Imagine that. We take a patient and we flip them from their back to their belly. That simple turn requires at least 5 specially trained nurses, respiratory therapists, and doctors just to keep them safe. Now, that's just for one patient. Let's think about taking care of multiple of these patients each day and the burden that places on our teams. These are the patients that I personally take care of. I and my team have been taking care of these patients for over a year now, as have many other highly specialized people across the region, the state, and the country, the world. These dedicated and highly trained people are now a year and a half into this global pandemic. They have been caring for these patients day in, day out, helping their loved ones be in communication as best that they can, holding the hands of those patients when they're alone, they're scared, they're confused, and when they're dying. This limitation of bed space, nursing availability, the rising number of sick COVID patients, it's not only impacting the sickest COVID patients, it's impacting all other patients who require care in our ICUs. ICU beds, ECMO beds are full. Just this week alone, I have received approximately 10 to 15 calls from doctors in our community, our state, and the surrounding tri-state area requesting ECMO for their dying patients. These patients are anywhere from the ages of 18 to 60, but actually this time, the majority are in their 20s to 40s, as you outlined, often otherwise healthy. These patients are healthy this time around, and the vast majority are unvaccinated. However, we have no space, and we don't have the additional nurses this time. We have to put them on the waiting list, something we learned to do during our last surge of COVID, when we had to turn multiple patients away because of resources. And too many times than not, these patients die at the other hospital waiting for this critical resource. Our nurses, our respiratory therapists, doctors, everyone, we're continuing to work hard for the people in our community, but we're tired. We do not want to see another patient die from COVID. I want to share one story with you that was probably the most heartbreaking calls I've gotten during this pandemic. Probably about 2 weeks ago, a dad from Arkansas left a message on my work phone asking me to call him about his dying 30-year-old son in Texas, asking for ECMO. When I called him back, he was at the airport heading back to Arkansas. His son, who was a father of 3, a husband who had worked 2 jobs to keep his family supported, and a veteran of the U.S. military, had died from COVID that morning. This father had called multiple places desperately trying to find a bed for his son that night, but no one could accommodate him. All I could do at that point was just listen to him tell his story, outlining so many beautiful details about his incredible son and his family. That was the remaining thing I had to offer him, a kind ear, compassionate words from a doctor he would never meet 1,000 miles away. We cried together that night, and I hugged my children tighter that night than I had done in a while. Our healthcare workers have been diligently working to protect our community for a year and a half. They are going to work every day to help be sure that you, your family, your children, kids, teachers, the coaches, the members of our religious congregation, your friend, everyone in your life and in my life gets the best treatment and care possible. But they've been working tirelessly for a year and a half to try to save the lives of those with COVID. We now need the help of the people in our community more than ever so that no one else needs to die from this terrible disease.
Thank you, Doctor. That's we appreciate what you do, and we appreciate all your colleagues what they do. Let me just, if I could, just ask you a couple questions. I wrote down, you said they are sicker, and it sounds like they're younger as well. Can you explain that? You say they're sicker. I mean, are they just sicker when they come in, when you get them? How does that?
Actually, if we go back a year ago in the winter, when we thought we had hit the peak, we thought we were at our peak, and this was soon going to be over because the vaccine was on the horizon. We often got calls for people who were 50 to 60. The number of calls were not as frequent and not as much. This time around, our criteria that we've narrowed for who get benefit from that critical resource called ECMO, everyone meets the criteria based on age because they're young. It's not uncommon to have 20s, 30-year-olds, rare actually to get a call about a 60-year-old at this point, which was very common back in the winter. And by sicker, these doctors in other small hospitals across Kentucky, Indiana, Ohio, who don't have the necessary resources that the bigger hospitals have, they're calling when they come into the emergency department and they're requiring high levels of oxygen because they know they need to get them to a place that can give them what they need, because they quickly become so sick that just the simple breathing on their own won't work. They will need the support of doctors and nurses that work in ICUs and big hospitals that they often can't get in those small areas. So the numbers are higher, the calls are more frequent, our waiting list is longer, and they're all young.
Doctor, I think that the average Ohioan might be surprised by what you just said, that you're dealing. I think that, many of us continue to think of those who are the sickest as the oldest. That's kind of what our experience was before. That's what we went through. Now most of our older people are vaccinated by over 80%. So I appreciate your candor. You talked about the 30-year-old, and you told us that story. Can you tell us anything about your general relationship with family members? Because this, again, is a kind of a unique medical problem when family, I guess, still many times is not at the bedside and can't be there.
Right.
I mean, it's going to be difficult. It's going to be very difficult for you because you're not only being a nurse, but you're trying to be everything else, I guess.
Yeah. So, well, as a physician now, was a nurse.
Excuse me.
That is probably the more difficult part, is the limited visitation that family can have when they can't go into the room because the patient has active disease and they're standing outside the room looking through the glass crying. sitting on a chair with their head and their face in their hands. All the words that our bedside nurses and respiratory therapists and docs offer is all they have. Oftentimes they don't have a family member with them to support them in their sadness. The conversations with families is often without answers. I can't tell them that I can get their family member home. I can't guarantee that. I can say we're taking it day by day, and I promise them that we will continue to give the best care to their mother, their father, their brother, their sister, their son, their daughters, which is more of what we're seeing now. We hold their hands. We allow them to hold, in circumstances where they're allowed to be in the room, we allow them to hold their family members' hands. But the hopelessness that we see in their eyes, we take home. All of us take home each night. And the burden that our teams feel is palpable.
Dr. Bennett, thank you very, very much. Doctor, we really appreciate you being on, and we appreciate what you do every day.
Thank you.
Thank you very much. Now let's go up to Fulton County. Alan Rivera, medical doctor. Doctor, thank you very much for joining us. We appreciate it very much. And Fulton County, a little different county than Hamilton County and Northwest Ohio. Tell us what's going on in Northwest Ohio, what you're seeing in regard to the COVID.
Thank you, Governor. As you pointed out, in contrast to Dr. Bennett, I'm in a very rural critical access hospital with a minimum limited amount of beds to begin with. And we are in, as well as I suspect the majority of hospitals across the state, across the country, we're in a crisis mode here in Wauseon, Ohio. And why is that? There's two big reasons, and Dr. Bennett pointed out both of those reasons. Number one, shortage of staffing. So as compared to last year, I believe our nursing staff is down probably 50%. We have nurses leaving the field, retiring early, finding jobs elsewhere because the long hours, the 16-hour days, the 20-hour days, extra shifts, the emotional strain that it is putting on them as the numbers continue to dwindle staff-wise is making them want to get out of the medical field. On top of that, as you mentioned, our COVID numbers are now going up. So in June and July, I didn't see any COVID patients. August, September, now the majority of my census in the hospital are COVID patients, and they are younger, anywhere from 30 to 50 is what we're seeing here in Northwest Ohio. And as Dr. Bennett pointed out, we have transfers to the city of Toledo. And the beginning of last week, every tertiary center in Toledo was on bypass. Every door was closed. The ambulances in Toledo were looking to ship patients out to us to take care of them when we don't have the beds because we don't have the staffing that we need to take care of those patients. So what do we do when we don't have the beds available? We're boarding patients in the emergency department, so they can't even get out of our emergency department to get into the hospital because we don't have the staff to take care of them. And for us, the issue with the COVID patients that are now filling up our beds, unlike the non-COVID patients that we could potentially get out of the hospital in 2 or 3 days, now it's 2 or 3 weeks. And when you're getting an admission or two every day to add to those beds that are being occupied for 2 or 3 weeks, that doesn't give us any capability to handle the heart failure, the COPD exacerbations, your acute appendicitis. These patients are ending up in our emergency department, being treated in the emergency department, and we only have a 15-bed emergency department. So if we start boarding patients and start using our emergency beds as hospital beds to treat patients for 2 days, 3 days, while we're trying to get patients on the floors, either discharged or transferred, that gives us less capability of taking care of those patients that are being brought in by ambulance, being walked in to be taken care of. Right now, we need the help, as Dr. Bennett said, prevention, prevention, prevention. We need people that could potentially not require hospitalization, get vaccinated. Protect yourself, protect your family, protect the community. Vaccination is the best way we have to prevent further hospitalizations of COVID diagnoses so that we can help treat the community to the best we can with the minimal resources we have. I had a patient last week in renal failure. We don't have a nephrologist. I tried to transfer that patient. There's no beds for transfer. The patient's renal function was getting worse to the point where they realized it was a dire situation and unfortunately chose to go the route of hospice care and die in hospice care because there was no way they were getting to a nephrologist. In our community hospital, we don't have a pulmonologist, critical care specialist, trying to prone patients, put them on their bellies. We don't have the resources to do that. We don't have ECMO to do that. We are at the bare minimum already, being at the lowest care of the rung of hospitalizations, doing the best we can with what we have. And I'm only one of 2 hospitalists. So a patient gets intubated, it's either myself or my partner trying to do the best we can as internists to manage those patients. We are doing the best we can, but we are crying for help to the community. Help us help you by getting vaccinated. Take care of yourself. Do the best you can to protect yourself with vaccination, mask wearing, social distancing, all that we did last year. So we're getting this influx. Last year, we had the nursing capabilities to handle a lot more patients than we currently have. So this situation is stressing not only the nursing care, our respiratory therapists, our environmental services, our PPE is being utilized. We're now using PPE that is disposable because we're short-staffed in the sanitary situation in the hospital to reuse some of our equipment. So it's affecting our entire facility, not just the nursing staff, the physicians, but dietary, environmental services, therapies out there. So I can't stress enough and beg our communities to do what is being asked prevention-wise and get vaccinated as soon as you can so that we can help you the best way we can.
Doctor, how many counties do you draw from besides Fulton? It's mostly Fulton, or do you have other?
So we have Williams County, we have Henry County. We actually draw from southern Michigan. We are getting some, we don't get a lot from Lucas, which is Toledo. We get some from Paulding County as well, but they're all critical access hospitals in those counties as well.
So one of the things that you said that really struck me is that if you're in any of those counties and you have any other kind of serious medical problem and go to your hospital, you may run into a jam getting in, basically. Is that a fair statement?
That is a very fair statement. I mean, we're doing the best we can, and if you come to our emergency room, we're going to see you, and we're going to do the best you can. But if you come in and you're having a heart attack and you need to go to a cardiac cath lab for intervention to minimize your heart damage, and those tertiary centers have no capability of taking those patients, the best we're going to do is medical management only. So it's still not the best outcome for those patients.
Doctor, thank you very much.
Unfortunately.
We appreciate what you're doing. And if you could thank everyone else at the hospital for us for their hard work. We know it's been a long 18 months. So thank you, Doctor.
Thank you very much, Governor.
We'll go east now to Muskingum County. Joe Bates, a nurse in the critical care unit of Genesis Healthcare in Zanesville. Joe, thank you very much for being with us. And I wonder if you could just tell us a little bit about what you see every day and how things are going in Zanesville.
Thank you, Governor. I think Dr. Bennett hit the nail on the head with what we're seeing in the ICU currently, and Dr. Rivera with the staffing issues that we're seeing. We're seeing identical things here at Genesis Healthcare in Zanesville. I work in a 24-bed ICU. It's a mixed ICU, so we see a lot of different types of patients. Currently, it's maxed out with COVID-19 positive patients. We have 22 currently in our ICU. 19 of them being positive, and 19 ventilators as well. So with the staffing issues that we're seeing, it takes a physical, mental, emotional toll on us day in and day out. As Dr. Bennett outlined, these patients require a high level of care. And if you're doing that for your entire ICU, it's just draining for the staff, the nurses, the respiratory therapists, everybody. And but we're pulling together, doing the best that we can, and then also, like Dr. Rivera had pointed out, some of these patients are they're here weeks on end, so we're those patients are long-term stays in the ICU, so having beds available for those other medical emergencies within the hospital, or patients coming in through the ED that need acute intervention, it makes it very difficult to try to get those beds available.
Well, you heard what the doctors had to say about the age. What age are you seeing there?
Our average age right now that we're seeing is around 59, with many of those being younger, as compared to last year was about 78 years of age. So definitely we're just seeing the younger population being hit hardest with this right now.
And any reflection on how you deal with family members? Again, it must be a difficult situation for them, difficult for you, obviously horribly difficult for the patient.
Yeah, yes, it is. With any of our COVID positive patients, they're not allowed to have visitation, which makes it very difficult for the family members. Some of the things that we try to offer, we provide update calls, we try to get a couple times a day, and then we do FaceTimes with family members just so they can see their loved one. But it still makes it difficult. And there's, we have intubated patients that are sedated that are having family members and friends pass away from the same disease that they're fighting currently. So, there's loved ones of theirs that are dying and they don't even know it. So very, very difficult.
We went through earlier on the show about the data about the vaccination rate. And of course, the vaccination rate for younger Ohioans is certainly a lot less. I don't know if you could have any reflection on that, what you're seeing or not.
I really don't have those numbers with me right now. I know that of the COVID positives that we have currently in our ICU, none of them are vaccinated that are on the ventilator.
Okay. You say none of them are vaccinated?
Yes.
Okay. Well, good luck to you and everyone at the hospital. We appreciate your good work, and it's been a long 18 months. So thank you.
Yes, thank you very much. Appreciate it.
Thanks for being on. We appreciate it very much. Thank you. We'll next go to Akron. Terry Alexander is joining us from Summa Health in Akron. Terry is a nurse, been treating COVID-19 patients. Thanks for joining us. We appreciate it very, very much. You're kind of our cleanup hitter today. So just tell us a little bit what you're seeing in Akron, and what the situation there is in the hospital.
Well, listening along to everyone else, it's easy to see that a lot of the information is the same across the board. We're seeing definitely from the beginning till now, our population is definitely a younger population, and they're a lot sicker. It was easy to see that we had started coming into the Delta variant or a different variant just by the way the patients were behaving. We knew right away we were dealing with something different. They weren't responding to the treatments the way they used to. We got to a point where we were kind of treating them, and you knew what to expect as we went along. But With this newer variant, they're so sick, and they're sick longer, and they're younger. I mean, you could hear 1,000 of these stories a day. I sent a 25-year-old to the unit. We've got patients in their 30s, and now we're dealing with, women who are pregnant and they're in their 30s. And it's just a sad situation that we're dealing with. And I think everybody here is emotionally exhausted and just really affected personally, at work and at home. It's hard to come in with the staffing levels that we have, with the shortages of equipment that we have, and play that balancing game that we play every day with beds, with equipment. This one needs a high flow. Well, we're out of high flow. What can we do to juggle this around and move that patient here and there? It's definitely taken its toll on us after 18 months, for sure. And it's tragic. It's tragic that it's just so preventable. If we could get the community to kind of unite and vaccinate, we'd be seeing these numbers go down. We could get a deep breath and hopefully get ahead of this, which is what we want to do. I've been in nursing for 26 years, and I've never seen anything come close to this. This is definitely a completely different experience in my career.
Any message for those out there who are 20s, 30s, 40s, and
Oh gosh,
who are not vaccinated yet?
Yeah, because when you're 20, 30, and 40, you feel, so strong and healthy and infallible to everything else. But, get the vaccine. It makes the difference. It's a tragic lesson. And I hate to call it a lesson for people to learn when they come in and they're young, 49 years old, and you're fit and healthy, and you come in and you're surprised you're on oxygen, and then you're surprised you're on that much oxygen. And now we have to start talking to you about, what's our plan B? Do you want to be on the ventilator? How far should we take this with you? Those are tough choices for somebody in their 30s to make, and it's just so preventable. That's the thing that's so shocking is, it's just so preventable. Please, please, please vaccinate. We live in a culture, I think, that has never experienced coming to the hospital and being turned away. And I think people can't fathom what that's truly like until it's them or their family members that are coming in and they're being turned away. Or we have to say we can't move this patient to the ICU. That's where they should be. But the ICU doesn't have a spot. And oftentimes those spots open up when we lose patients.
Thank you. Thank you very much for what you do. Please thank everyone else at the hospital for their hard work. It's been a long, long time. And, for those of us who are not in there, it's hard for us even to imagine how tough that is. But we appreciate it.
Oh, thank you.
Thank you very much.
Thank you.
Thank you. We're ready for questions. And all four will stay on here. And if anyone has any specific from the news media, any questions for any of them, the doctors, the nurses, they'll stay on. So.
Governor, first question today is from Allison Walker at WKEF in Dayton.
Hello, Governor DeWine. Thanks so much for taking the time today. Do you expect Pfizer's anticipated vaccine approval for kids 5 to 11 to drastically change the course of this Delta surge?
Well, it certainly is going to help. And, I think it'll make families, a lot of families feel better. I know a number of families, and we have some of our children who are in this situation who have children who some have been vaccinated and some have not been vaccinated. And so they're kind of living two different lives and trying to figure it out every day. I'll leave that up to Dr. Vanderhoff or anybody else who's on here.
Well, Governor, thank you. And I agree with you. I think it is something that we're all looking forward to. Can't come soon enough. But I think that it is just one more piece in this very important puzzle that gets us out of COVID-19. The key is vaccination. The key is our immunity, and nothing really does that as well or as safely as getting a vaccine. So I think we're all looking forward to that age group being added to the list of eligible.
But we continue to look at the numbers for those people who have been eligible for some time. And if you go from 20 to 40, we're right at 50%. I mean, so we got half the people 20 to 40 are pretty well covered, and in all likelihood are not going to end up in the hospital. But you've got the rest of the other 50% who are not covered at all. And you've just heard the nurses and the doctors talk about what they're seeing every day among 20-year-olds, 30-year-olds, 40-year-olds. So, it's not like we're going to get this and the door is going to open, everything's going to get better. It's going to give us one more group to vaccinate, and we're going to make that available and encourage everyone in that age group to get it, but it's not going to solve all our problems.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Thank you, Governor and doctors, for doing this. I want to ask about the staffing. Ms. Alexander was explaining the problems in the hospital. Well, all of you have talked about the problems with not having enough staff, nurses. Some of the school officials are talking about not having enough school nurses. And we know that this is not going away anytime soon. So what are you doing to try to increase the staffing, one? And number two, in the meantime, when you can't increase the staffing or the capacity in these hospitals, are you making plans for who gets care and who doesn't?
I'll let anyone take that wants to.
Well, I know at our hospital, we're starting to get creative with our staffing. So we've started bringing LPNs in again to the hospital to kind of be support staff on the floor, which is helping tremendously. We try to keep our aid staffing ratios up as high as we can. And I know that all of us are picking up extra hours to help our coworkers out on the unit. I know we've got a lot of incentive programs with our recruitment team. So I think that we're doing everything we can to fish out some more staffing. It's just the environment doesn't seem to have a ton of extra nurses available that want to do this.
Yeah, and this.
And we're offering.
Go ahead.
Sorry, go ahead.
So
we're offering bonuses to try to encourage nurses to come work for us, signing bonuses. It's very difficult in rural America to compete sometimes with some of the other facilities. It's just that I don't think there's enough bodies out there. And you mentioned how we looked at the possibility of turning patients away or not treating patients. In our facility, that is not an option. We haven't brought that to the table. If you come to our hospital, we're going to do everything in our power to take care of you one way, shape, or form. It may be a little primitive in the emergency department at times, but not treating is not currently an option that we're willing to even look at our facility at this time.
Thank you.
Governor, the one thing I did want to add, and just as a reminder, that the best option is the option of not needing to be in the hospital, the option of never getting that sick. And I think we would all agree it's achievable, it's attainable. It's as easy as going to your provider, going to a pharmacy and saying, I'd like the shot. They give you the shot and you are on the path to being very well protected.
Next question is from Scott Hallis of the Xenia Daily Gazette.
Hi, Governor. How are you?
Scott, good.
So, as the vaccine becomes available to younger kids here shortly, we hope, is there any thought of maybe going back to an incentive type thing when you had the lottery drawing, a while back, and that seemed to increase the vaccinations. There was, mixed criticism about it. Any thought of having another type of incentive to get more people to become vaccinated?
Yes, we're thinking about it. That's about all I can tell you today, but we're certainly thinking about it. We're looking at these numbers, and they simply have to go up. And we just, everybody that gets vaccinated is not only doing something for themselves, but they're doing something for everyone else. So it's, we're thinking of other options, and it worked exceedingly well for about 14 days. It was just phenomenal increase, and we got that, and that's important.
Next question is from Alex Ebert and Bloomberg.
Thanks for having this conversation, Governor. This question is for you. I'm going to try to connect the wonky subject of redistricting with the pandemic in front of us in a more visceral way. The veto override vote in the House for Senate Bill 22, which stripped your ability to issue mask mandates, was only 3 votes. And those votes were really only there because of maps that were created a decade ago in which your party entrenched power. Last week, you voted for a similar map that entrenches that power again. How do you view your vote last week in light of the pandemic and the way that the political system in Ohio, with that re-entrenchment of power, can prevent you or another governor in the future from issuing mandates? Thanks.
Yeah, I think I was pretty blunt about what I thought about the process and what I thought about the end result map. But it was also clear to me, as I said that night, that the two sides were not going to come together. I had hopes that could happen. I was willing to, frankly, go beyond the deadline that night at midnight with the hope that we would be able to pull people together. I talked to both sides. I respect both sides. But after I talked to them, it was abundantly clear that there was no middle ground, that we could wait a week, 2 weeks, 3 weeks. It was not going to come together. And so we needed to move forward. We needed to hit the deadline. This matter obviously will be decided in the courts, and we needed to move on. So I think I made it pretty clear that I thought that the result was not where we needed to be, that we needed, that we could do a better job. But that kind of a compromise was clearly not going to be, not happening.
Next question is from Luann Goya at WSYX in Columbus.
Thank you all for talking with us this afternoon. My question is regarding the firefighter who passed away here in Columbus this week. Columbus had a firefighter who was working in the line of duty, according to CFD. He has passed away. What are your thoughts on mandatory requirements for vaccinations for first responders and just in general reaction to this first responder death?
Well, I guess I'll go first. First of all, a great tragedy, and our heart goes out to the firefighter's family. My position has been that this is a decision that's best left, in this case, to the city, or to a township fire department, or to a hospital. I think, I've opposed mandating that anyone get vaccinated or saying that they could not mandate get vaccinated. I think there's a limit to where government should go. There's a limit to what the state government should be doing. We should stay focused on trying to encourage everyone to get vaccinated. We're trying to do that, obviously, today. So that's about, those are my thoughts.
Next question is from John London at WLWT in Cincinnati.
Hey, John.
Yeah. Hi, Governor. I have a question for Dr. Bennett. And, I reflect back on Dr. Rivera talking about the nursing shortage, 50% since last year, and now the majority of patients are COVID. And as you know, Dr. Bennett, the vaccine mandate deadline for Greater Cincinnati hospitals is is fast approaching. Do you think that that is having the desired effect, or will there be an exodus? And just off the top of my head, since you've all bared your souls here today and last week as well, hearing from all these doctors and nurses, would you or anyone there like to see, based on what the governor said a moment ago, direct significant cash payment for a specified time to the unvaccinated to get vaccinated?
Thank you. To answer the first question regarding whether or not we expect a mass exodus, I think that remains to be seen. I know that our health collaborative and health systems in the health collaborative have been working together to make it so that we are meeting the needs of our community and our patients and each other by pushing to get everyone vaccinated, while at the same time balancing the concerns of what you just mentioned, which is people leaving our health system and the health systems in our region and in our state. So I don't think we know the answer at this point, and I think people are continuing to talk about how to deal with that in the event that it does present itself. The financial incentive for vaccination, I think we need to do whatever we can do to encourage the unvaccinated people to get vaccinated. We can't continue to do what we're doing. As was outlined by Dr. Vanderhoff, the best thing to do is to get vaccinated so that we reduce the resources that we need based on the current nursing shortages that we have nationwide, not just in the state of Ohio. Because what we're doing currently to our nurses is asking them to work more hours, to more days, increasing their workload. That is a vicious cycle that we cannot continue. And the answer here, again, is prevention, and that lies within people getting vaccinated.
You know, and I'd like to respond, if I may, just to backtrack a little bit to the first responder and point out that in healthcare, way back when you even tried to get into nursing school, you had to be vaccinated to get in. You had to be vaccinated. You had to show. We all went running to the application process with our immunization booklet. And as long as I've been a healthcare provider, you know, there are certain vaccinations we've been required to have. The influenza vaccine came along about 10 years ago. They started mandating, listen, if you want to work around patients, because we put them at risk. And so it's not a new thing that we're saying, hey, as healthcare providers, we should be doing everything we can to keep our patients safe. It's just going along the course of prior actions, I guess. You know, it's the best thing for the patient. So that's my take on it.
Next question is from Jim Province at the Toledo Blade.
Hi, thanks again for doing this. I don't know if this is a question for Dr. Vanderhoff or one of the other doctors, but as we hear about the ICU hospital beds filling up, are the regional hospitals close to triggering the emergency plans that they put together a year ago to ensure that there would be enough beds, such as converting convention centers, et cetera?
Yeah, thank you. I'll start off with an answer to that question. You know, the challenge is different at this time than it was back when we were all standing up those sites. We still have the ability to stand this up and stand them up very quickly in terms of the physical steps that need to be undertaken. But the issue that we're talking about here today is staffing. You simply don't train an ICU nurse quickly. It is a very long process to develop the level of competency that's needed to provide that level of care. And so those plans really are not pertinent to the challenge that we're talking about here today. Now, the response of our healthcare providers has been remarkable. Our healthcare systems has been remarkable. You know, through our zone structure and through our regional planning, our disaster planning, as well as our very evolved trauma system, we've really been able to do in Ohio a remarkable job at moving patients from one location to another, or moving resources, physical resources, from one place to another. But the challenge, the sticking point for us, just like the rest of the nation, is this shortage of the healthcare heroes who are getting worn out. And that's the constrained resource that we're dealing with. Thankfully, due to their dedication, thankfully, due to a lot of planning and infrastructure, we've fared much better than many other places in the country in the face of that. But our plea continues to be, look, this is all avoidable. This is all preventable with a vaccine. So please, if you haven't been vaccinated yet, get a vaccine. I'll defer to my frontline colleagues if there's anything that they would add.
We in Fulton County have discussed that actual question, and the answer is, as Dr. Vanderhoff pointed out, we have the capability of the physical part of that emergency plan to handle the surge last year, but it does us no good to put the physical part of that in play when you don't have the medical resources and the staffing to implement and take care of those physical locations in that emergency plan. So I believe we had a wonderful plan last year, and thank the Lord, we never had to implement it last year. And now we're getting the surge this year that we're feeling, not because we have more COVID patients, but because we have less staffing to take care of the same amount of COVID patients. So again, I just reiterate staffing. I thank our nurses that are still on the front lines doing their job day in and day out, whether they want to come to work or not. Because of the stress, they do it, and they do it well. So again, prevention is always the key. You vaccinate, but we don't have the capability because we don't have the resources to implement that without our wonderful nursing staff.
Well, I'd like to say thank you. And I think we're hearing the same thing across the board as, as healthcare providers. We always want to say, yeah, the positive on it. We can do this. We're all sticking together. We're all working together. But it's important to remember that it's just not sustainable in the long term. People are wearing out and they are tired, and we all want to do our best, obviously. But if we can get people to start vaccinating, we hopefully will never get to a point where we truly have to say there's nothing else we can do. We don't have enough people. We don't have enough space. We don't have enough, I never personally want to say that to a patient ever. So, I hope everybody vaccinates. I hope people start moving forward. And as far as the money incentives from a nurse perspective, I'm all for, if we can offer money for people to come in and get vaccinated, I am all for it. And I'm sure a lot of the people that I'm working with right now are too.
Next question is from Jim Oddie at WHIO in Dayton.
Governor, good afternoon. I wanted to see if you are playing a role either directly or indirectly in any talks on House Bill 248. For those people that have been following, that's the anti-vaccination mandatory bill. What role are you playing in that to either try and get that bill put aside, to have it changed dramatically more to your liking, or to pass something else that perhaps you think might be able to fly in this legislature that you could live with?
Jim, I'm not involved at all in any discussions. I've made, my position very clear. We should not be telling hospitals how they run their hospital. We should not be telling business how they run their business. If a hospital feels that they want to require everyone to be vaccinated, they ought to be able to do it. I feel the same way about a university. We send our kids and sometimes not kids, adults, and in our case, grandkids off to college, and we expect some level of care from the university to do everything that they can and to protect that young person. And universities need to be able to make the decisions. And if they make a decision that they think that someone needs to be tested, they should be able to do that. If they think that there should be vaccinated, they should be able to do that. Government should not get in the way of those people who are really charged and have the ultimate responsibility. You know, it's easy for government to get involved, but if people who have that responsibility at that college level, you know, we should not be interfering with what they're doing and telling them they can't vaccinate. They can't require people to be vaccinated.
Next question is from John Reed at Gongwer News Service.
Good afternoon, Governor. Back to the redistricting question. It looks unlikely that the legislature is going to act on congressional maps in the next 10 days or so, and it'll likely go back to the commission. Is there anything you'd like to see the commission do differently this time around that might get to what you would think would be a better outcome, a better process?
Well, it is a different situation. You know, you start off, of course, knowing that you have to pick up, you know, a congressional seat or you lose a congressional seat. So obviously the lines have to be drawn differently and we have different numbers. But you know, I don't have anything to offer today. Again, I think that I made my comments about, you know, what we did in the previous, and, you know, I'll stick with those comments for today.
Next question is from Farnoosh Amiri at the Associated Press. We will go back to Farnoosh. The next question is from Christian Hauser at WKRC in Cincinnati.
Good afternoon, Governor DeWine, and thanks for taking my question. Each time you have a news conference, we hear new COVID horror stories in medical facilities from across the state, but it doesn't seem to really have a significant impact on vaccine rates or school districts implementing mask mandates. The state could now see fewer monoclonal antibody treatments as well, which means more people could experience severe sickness or death. As the colder winter months and likely increased spread approaches, worsening an already bad situation, you know, at what point can or will your office or the state do something other than asking people to do the right thing? They just don't seem to be listening.
Yeah. Look, we've done a lot of different things, as you know. We did the Vax-A-Million. What people are not seeing, you know, behind the scenes is, you know, how many different incentives we're offering out there. We've told every health department in the state, if you want to offer a monetary incentive, you can do that. We will pay for it. They've reported back, a number of them, that they think that has made a difference, that has increased the number of people who have been vaccinated with those very significant incentives. So, you know, we also, you know, I think have an obligation to do what we're doing today. And that is put out in front of the people of the state what the facts are. We've tried to do this for 18 months. We've tried to get in front of people what really is happening out there, at least the best we knew it at that particular day. And there's nobody better than the healthcare professionals who talked today and looked in the camera and told the people of the state, this is what we're seeing. We continue to average about 10,000 new vaccinations a day. That's not enough, but it is 10,000. And when you think about, these are 10,000 people on the average who for months and months and months have not taken the opportunity to be vaccinated. They decided to become vaccinated. I think part of that is that they know people who have gotten sick. They may know people who have died. They're seeing what's happened. They maybe see a story in the news, on TV, hear something on the radio. Who knows? So, you know, we're not ruling anything out. We're thinking about other things that we could do. But a lot of what we're doing, candidly, I'm not sure that the average person out there knows about. And again, a prime example is, responding to the requests of the local health departments who have come up with ideas and this incentive or that incentive. And they've come up with some good ideas and good targeting, and it's had certainly has some impact.
We'll go back to Farnarsh Amiri at the Associated Press.
Hi, Governor. Hopefully you can hear me now. So I don't know if you've been keeping count, but I think we're up to at least 180 of these COVID pressers that you've done since the beginning of the pandemic. And each time, the similar, frontline workers and yourself, there's been pleas, whether it was masking or social distancing. And now, obviously, as we all awaited the vaccine, we've spent the past few months pleading, whether it was you or the medical professionals in the state. And I do wonder, at the same time, members of your party, whether it's at the State House or in Congress, have been working, actively to try to make vaccine mandates, to ban vaccine mandates, to ban masks in schools. And I'm wondering at this point, what is your response to that, and how do you bypass this instead of just weekly being able to come on here and have nurses and medical professionals cry and get obviously extremely emotional about what is happening in Ohio?
Look, we're in better shape in Ohio than they are in some states. As you know, some states have banned the ability of a hospital to require vaccinations. They banned the ability of schools to mask. That's not the case in Ohio. As I said, 59%, as far as we can tell, 59% as of today of our school children who go to public schools are wearing masks. I wish it was 100%, but it's 59. And so that makes a difference. We are seeing in our schools, case after case, county after county, where the schools that are requiring masking are not losing as many days for the kids to be quarantined. And we knew that going in. We're also seeing not as many kids get sick. So the proof is there. It's abundantly clear. And I certainly just hope we're going to continue to talk about this. We're going to continue to put data out that will convince more of our superintendents, more of our school boards to put on a mask order. Look, I know it's difficult. I know there are people who oppose that, but we have to protect our kids. We have to protect our community. And this is how we do it. And this is how we keep our kids in school. I think everybody agrees we need to have our kids in school. This is the way we keep our kids in school. So I'm going to continue to talk about it. We're going to continue to put out the facts. We're going to continue to drill down on the data and report to the people of the state, including people who are making responsible decisions and have to make decisions, such as superintendents and school boards. We're going to continue to put that information out. This week we're doing a call in for any member of the school board, any of the school boards in the state who want to talk directly to the children's hospitals. Children's hospitals want to talk to them. These are not biased people. These are not political people. These are not necessarily Democrats or Republicans, but these are people who are worried about the capacity of the children's hospitals to serve our kids, all of our kids. And they want to talk, and they want to have a good exchange with the members of the school boards who are making these decisions across the state. So look, we're not giving up. We've made some progress. We'll continue to fight on.
Next question is from Jake Zuckerman at the Ohio Capitol Journal.
Hello, everyone. I have a question for any of the doctors and nurses on this call. Right now, 53% of Ohioans statewide of all ages are vaccinated, and that compares to about 64% nationwide. As of last week, 66 of 88 counties in Ohio have not cracked 50% as far as vaccination coverage. President Joe Biden has proposed a mandate among workers for large employers. Governor DeWine called that mandate a mistake, and the state attorney general has threatened a lawsuit to stop it. Do you, as health professionals, believe a vaccine mandate is an appropriate response given the malaise we're seeing in vaccine uptake? Don't all talk at once, guys.
Let me
I feel
just.
like I'm going to regret touching base on this, but it's a sticky, touchy situation when you start thinking about infringing, I suppose, I don't know what the right word is, on somebody's right to decide whether they get vaccinated or not. And, I certainly am obviously for getting vaccinated because it had such an impact on our everyday lives across the country, in other countries. This is affecting us on such a huge level that at some point we have to start looking at how can we at least slow it down. I can only speak for myself, and I can only speak for, my healthcare system. I'm glad that we have the vaccination protocols in place that we have. The last thing that I would want to do is come in and take care of a patient and cause them to be sicker than they already are by something that I'm carrying around. But in my heart of hearts, I can't help but think it wouldn't bother me to have this vaccine. I'd like to see the numbers go up, and I'm not sure what the answer is in getting that to happen, but I can tell you what I'm seeing on an everyday basis. And I don't get on here and cry because I want you to see my tears and go get vaccinated. I get on here and I cry because these stories, these people's lives have affected mine. But what I want people to see is that these are real people, and they're them. If they don't get vaccinated, they're potentially them, and nobody knows what's going on behind closed doors when they're out running around in the community. And if we don't share those stories, then they might never understand fully until it's too late. They're in those shoes. They're in that bed. They're making that decision. So that's my 2 cents on that matter. And I hope I stayed focused enough for you to pull something out of it.
I'll comment on this. Obviously, this is a hot topic, and it's a sad state of affairs that it's gotten to this point. We as people who are around people, we have family, we have friends, we have a commitment to each other. And for it to get to a point that we have to ask for government involvement to mandate something that we know that is based in science and evidence that can prevent deaths, that's unfortunate. And I think if we could limit the amount of false information that is out there related to the vaccine and reduce the barriers for the people who live their daily lives, my family, my friends, all of them who have those same concerns. If we can cross that barrier and focus on reaching them so that they don't make that decision after seeing one of their family or friends die, that would be a success. And I would be supportive of encouraging and continuing to get that information out to the people who have concerns about the vaccine.
Next question is from Tom Jackson at the Sandusky Register.
Tom.
Thanks, Dan. I was struck by a comment from Joe Bates that every one of the people in his hospital who are on ventilators are unvaccinated. And I was wondering if some of your other co-stars, some of your other doctors and nurses could tell me if they've seen very similar situations at their hospitals.
I can speak to that in Cincinnati, and all the calls I get for the severely ill patients asking for ECMO, they're all unvaccinated.
Joe?
The majority of our patients here in Wasion are also unvaccinated. We currently do not have anybody intubated in our ICU. We do have a gentleman in our ICU, his on BiPAP. He's not requiring intubation at this time. He has been vaccinated. So we do see those occasional vaccinated patients still ending up in our ICU, but he's not intubated. And I have to believe that the reason he's not intubated is because he's been vaccinated. So again, the majority of our admissions are unvaccinated patients, and they're ending up in our ICUs. But every once in a great while, I mean, the vaccine they claim is 95% effective. Well, I think it's doing a better job of preventing hospitalizations and preventing deaths better than 95%. But you still have an opportunity or a chance that you may get infected. But I still believe it is preventing intubation and deaths. So it's still the best preventative measure we have out there, in my opinion.
Remember, when we look at the statistics that Governor DeWine posted, if we took 100 patients, 97 of them would be unvaccinated in the hospital. That would leave only 3. So there's still a small number, but just to put it in perspective.
Next question is from Jeremy Scott at WTNS Radio in Coshocton.
Yeah, this question is for Joe Bates. Joe, I'm kind of wanting to compare notes a little bit, seeing as we're a neighboring county to Muskingum. We've had 2 big news releases this month from Coshocton Regional Medical Center. One was just a basic PR push to keep the emergency room for truly emergent situations and to therefore utilize urgent care more than it's being utilized right now. But then the other one that we got from them was announcing the fact that elective surgeries are postponed until further notice, and also the fact that non-isolated patients may only have 1 visitor at a time, and isolated patients, except for maybe a few exceptions, cannot have any visitors. So I'm just curious as to if Genesis is kind of approaching the situation the same way, or if Coshocton Regional Medical Center is on its own island when it comes to that kind of thing.
Yeah, very, very similar here at Genesis. Like you pointed out, certain circumstances allow visitation to come in for COVID positive patients. As far as elective surgeries, right now it's kind of like life or limb, basically emergent type surgeries is what we're doing. But that's kind of where we're at. Very, very similar.
Thank you.
Thank you.
Next question is from Jamie Ostroff at WCMH in Columbus.
Afternoon, Governor. This question is regarding schools. Numerous school districts throughout Ohio, large and small, are reporting some issues with the shortage of bus drivers. Do you have any sort of plans, and are you able to involve the National Guard into helping children get to school?
Yeah, I've asked General Harris and other senior members of my team to take a look at this to see what's can be done. General Harris is in the process of putting a option together, and we should have something to be able to talk about in the next day or two. What I don't know is whether or not we have a viable alternative for these schools. Most superintendents have my email, and I'm getting emails from them talking about the school bus driver shortage. And I'm hearing from parents about what that means. A child that normally would be, dropped off at 4 o'clock is now on the bus until 5:15 or 5:20. So these are real stories. These are real people. This is clearly a real problem out there. I don't know what we can do, but I've asked our team to see if we can come up with some ways to help. So we'll be back and talking about that in the next few days.
Governor, next question is the last question for today, and it belongs to Carl Capon of WEWS in Cleveland.
Hi, Governor. Yes, my question kind of revolves around the same thing about the school bus shortage. And I know here around our area at the Euclid School District, they're canceling classes now because they just don't have bus drivers. And I believe the superintendent, we're told, has reached out to you. You're talking about solutions. what are some of those solutions or other solutions besides activating the National Guard that could possibly help these schools get the children to, class?
Yeah, I mean, look, I've asked people who've contacted me if they have specific ideas. We obviously are looking at the licensing issue, and if there's anything we can do there. We're looking at manpower situations. So, we're looking at who else in our communities in the state, has the legal ability to drive a bus and has the skill sets needed to drive a bus. Obviously, these buses contain our most precious things that we have, and that's our children. And so we want to make sure we do whatever we do it in a very careful manner. So it's a problem. I recognize it's a problem. We're taking a hard look at this, see what we can come up with. I want to thank everybody. I want to thank our nurses, our doctors. Thank you all very, very much. We again appreciate what you do. Thanks for taking 90 minutes out of your very busy schedule to be with us and to share your world, what you see. It's a world that for the rest of us who are not in the ICU or not in your hospital, we can hear about it, we can read about it, but it's so much more impactful. Certainly has been impactful for me just to listen to you describe that. So thank you for your honesty and thank you for what you do every day. Thank you very much.